Hello everyone, this is Dr. Kawthar coming to you from Muscat, Oman. Today I'm going to talk about challenging behaviors of children with autism in the classroom. As everyone who has ever gone through school knows, good behavior is critical to a student's academic performance. However, when we talk about children with autism spectrum disorder, these students struggle with behaviors that are counterproductive to their progress in school and even disrupt other children. Now, if your child is having behavior issues, a team of specialists may do something called a functional behavior analysis, or an FBA. What is an FBA? An FBA identifies the background, meaning what happens before the behavior, and consequences surrounding a specific behavior, and it creates a plan for intervention that will help alter this behavior, as well of ways to measure whether this intervention is actually working. Now, this progress begins with first identifying the problem behavior in clear, concrete terms. For example, rather than saying Faris is very rude or Faris is very naughty, an FBA would say Faris shoves, kicks, and hits other children during transitional time. The description needs to be expressed in specific, observable, and measurable terms. Next, a plan needs to be created to collect data. Gathering data may be done either directly or indirectly. Collecting data directly involves observing circumstances surrounding the problem behavior. For example, we might ask, does the problem behavior occur just before lunch when the child may be very hungry? Does it arise whenever the child may be in a crowded hallway or in an auditorium? Is the child more apt to act out when new lessons are being taught? Are behaviors preceded by the same incidents every time? These are very important questions that the team of specialists will consider so they can determine the cause of that negative behavior. They will investigate how often the problem behavior occurs and in what kind of intervals. Also, they may do a behavior observation, as this can be helpful as well. Each time the child misbehaves, they will record the inappropriate behavior and what happened just before it, and then they will record what happens after it, meaning the consequences of that behavior. They will only record what they see and hear without actually interpreting the behavior or giving their opinion. Gathering information may also be done indirectly. For example, using student records, questionnaires, or checklists to see how others may perceive the child's behavior. It may involve interviews with other teachers or staff members to find out who is present when the problem behavior occurred, when and where it tended to happen, and what's happening before and after the behavior. The information is collected from several sources, including teachers, administrators, counselors, and therapists. After a few days, the team will begin to see a pattern that links the child's behavior with their environment. They may be able to predict the events that lead up to the problem behavior and identify sequences that actually perpetrate it. Now, remember, most problem behavior serve as a purpose, and it is done to attain something or to avoid something. It is critical also to understand that certain aspects for a child's autism may be the underlying cause of a behavior. For example, a child with oversensitive hearing may act out during a noisy class. Many children with autism have sensory issues and can get overstimulated. So an intervention also needs to consider sensory and biological problems that may be part of autism. The next step is to implement a behavior intervention plan. Children generally respond better to methods that are positive and which encourage and teach appropriate alternate behaviors. And I cannot stress that enough. Positivity gives a better result than negativity. Some of the techniques may be such as modifying the physical environment, adjusting the curriculum, or changing the consequences of the problem behavior. It is also helpful to teach more acceptable behavior that will serve the same purpose. Once a plan is implemented, the child's progress will be monitored and observed over time. If the team finds that interventions aren't working, they will have to go back and study the original plan and probably devise a new strategy. Thank you for listening and have a great day.